Live streaming. Here we go.
Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We're so happy that you chose to spend some time with us. We're looking forward to having an invigorating discussion as usual about some of the things that are happening in our world and how we can impact the health in our community. Without further ado, I will turn it over to Dr. Randall Maxey, our founder.
Thank you so much, Dr. Neighbor-Stevens. Both of our other co-moderators, Dr. Walsh and Dr. Hines, on a cruise in Hawaii, and they didn't invite Dr. Neighbor and me, so we have to go next year on a different time. I hope to have a very exciting time today. For many of you who may be doing this for the first time, we originally had a mission of giving vetted knowledge about COVID-19, health disparities. And now that the COVID-19 is supposedly over, we switched mostly to health disparities and also some social disparities. So I'm in New Orleans at the National Medical Convention. And I had good fortune 2 days ago to meet one of my very good friends, Dr. Walter Fage. And he introduced me to the gentleman who's going to speak to us a few minutes today, Dr. Haywood Hall. And Dr. Haywood Hall taught me some new things. So I'm going to have him introduce himself to you, and he's going to speak to us a few minutes, and then we'll have some questions, and then Dr. Neighbor-Stevens will talk about some health advocacy things. And we spelled open mic as M-I-K-E in one edition, so excuse my spelling, I only got a C. But Dr. Haywood Hall, who's an emergency room trained physician, who happens to live in the country of Mexico. And I'm going to ask him to introduce himself and give a little of his background. Dr. Haywood Hall.
All right. Well, thanks for inviting me. So yeah, my name's Haywood Hall. I went to Baylor College of Medicine and I trained in internal medicine and emergency medicine. My career has been emergency medicine, but my focus has been international development. And I've been doing a lot of work, a lot of development work in Mexico and Latin America, and the provision of emergency care and training communities. For instance, we have a training center in Mexico, and we actually work all over Mexico. And the training center is an American Heart Association center, and it's also an advanced life support for obstetrics training center, and we've trained a total of 50,000 healthcare providers at all different levels of care. We have a special focus on maternal. One of our strongest courses is advanced life support for obstetrics, and so we've had a lot of experience working in all kinds of marginalized communities trying to make that work. I was raised in Mexico till I was 8. I came back to the States for a while, and then ultimately I wound up back in Mexico. There's a very long, convoluted personal history, but in any case, I'm here. I'm giving a couple talks. One was on my father was a very active civil rights organizer. He was born in 1898. My father was, my grandparents were born slaves, so I'm the grandson of slaves. So And the other talk I'm giving on is it's part of a panel discussion on trying to decrease maternal mortality. As you well know, the maternal mortality rate for Afro-Americans is 3.5, 4 times more than it is for white women. And in some places, I've probably heard this yesterday, like places in Brooklyn, it's 8 times higher than white women. So anyway, I'm just here and see if there's whatever I can reasonably do to help, or any type of anything that I can reasonably support with. I'm interested in. I'm really a global health person. But I think there's a lot that can be learned working in areas that have where there's limits to the healthcare, and trying to analyze those kinds of things. I think.
So tell me a little bit about your social history. I understood that most ex-slaves travel north to get out of segregation, but that's not true.
It's an interesting story. We've not heard the whole story. Of course, the Underground Railroad took blacks north. Here's an interesting thing. We think that the Civil War was the war against slavery, and the first war against slavery was the Mexican-American War. There was the thing that sparked the war between Mexico and the United States was that the settlers, the Anglo settlers, had slaves, and Mexico had outlawed slavery. In fact, the second president of Mexico was Afro-Mexican, Vicente Guerrero, and one of the founding fathers was as well. And there were plenty of slaves who, guess what? They went south. Why wouldn't they? I mean, why would they necessarily go north? So
David Crockett was a slaver. Kit Carson, all those people heroes.
Yeah.
Sam Houston.
People say remember the Alamo. I'm saying, what are we remembering exactly? And you get this kind of maybe a footnote in history about slaves having something to do with this. Most people don't think of it as that at all. There's a whole cultural mythology around how it is that basically how Texas and other territories that were part of Mexico were appropriated onto the United States. And there are all kinds of various pretexts and things. These are long, complicated histories. I'm not a historian, but I do follow those things. Like Juneteenth was being celebrated in Mexico for a long time. There are Black communities that were established by Afro-Americans in Mexico. Los Angeles was founded by Afro-Mexicans. Los Angeles is the second largest Mexican city in the world. There's Mexico City, 21 million people. Then there's Los Angeles, and then there's Guadalajara, and then there's Monterrey. I mean, so there's just all kinds of things we don't really know. There's 2.5 million Afro-Mexicans now. 2.5 million. They're mostly in the state of Guerrero and Oaxaca and in Veracruz. And there's some that are kind of in the northern part, and those were slaves that had escaped. So, we're so we're cut off from all of that kind of history. And it's, it's really, when you learn those things, feeling more connected, your roots feel stronger, and, you start to understand more of the context of things. And so anyway, you can see this could go on for quite a while.
Dr. Neighbor, you knew about the Southern history more than me, right?
Yeah, I knew a little bit more than you, not a whole lot more. But I wanted to ask Dr. Hall, and if this is too sensitive, let me know. I'm actually a legal resident of Florida. So my question is coming out of my dealing with my state.
Sorry.
Yeah. So is there an effort in Mexico to hide the history of Black Mexicans?
To hide the history?
Is it thoroughly integrated into the teaching of history in Mexico?
So for the first time, Mexico allowed people to declare their cultural identity and the 2020 census. And surprise, there were 2.5 million people who identified themselves as Afro-Mexicans. There's, I don't know what the actual number is, and I'm not even sure how you make the criteria, because the criteria changes from one country to another. For a while, if you had one drop here, you were in the United States, you were Black. And in Latin America, you'll find that they have, they've categorized people by whether they're, mestizos, mulattoes, octoroons, maroons. There's all this stuff. But in any case, 2.5 million have identified themselves as Afro-Mexican, and the present government is very friendly towards the diversification of the culture, because they're actually, it's not a monolithic culture. There are all these people, they speak their own languages. There's probably at least 30 different languages spoken in Mexico. It's not just necessarily Spanish. But one of the things, I've been in Mexico long enough. I think it'd be pretty interesting thing to be able to connect Afro-Americans from the US to the Afro-Mexicans. They're very interesting people.
Absolutely. I was so impressed when I met Dr. Haywood Hall that he was a Black Mexican, American Mexican. You've been around.
I'm a little mixed.
And I suppose you speak Spanish fluently.
Yeah, it was my first language. I spoke Spanish. Now, I was born in Brooklyn, okay? My parents, basically, in the 50s, they were kind of purged and chased out of the country because of their political activism and their civil rights activism. And so my father was Harry Haywood. You can look him up, Harry Haywood. You have to kind of fasten your seatbelt because he had quite a story. But he was, like I said, he was born in 1898. He had to, you can imagine what life was like till 1915 in World War I. He fought in an all-Black battalion in World War I that was relegated over to French command because the US would not command their Black soldiers. And he came back, and there was the riots, there was massacres in 1919, the Red Summer. And so my father got radicalized. He said, well, let's see, Democrat or Republican? See, okay, Democrats, that's where the Klan came from. Okay, the Republicans, where are they? Well, they kind of, Reconstruction was delivering the South back to the Ku Klux Klan, basically, from his point of view. And so he got pretty radical, and he wound up connecting with the whole international communist movement. And he went to school in the Soviet Union. He went to school with Ho Chi Minh and a bunch of people, very prominent. He was a command officer during the Spanish Civil War. J. Edgar Hoover hated him and did everything he could to keep him and all of his people away from the civil rights movement. And, many people were killed, that. And so my parents took me to Mexico, and that's where I grew up. So we're kind of political refugees in that sense. I came back long enough, learned English, came back in the mid-60s. Actually dropped out of high school, but eventually I got back on track and wound up in medical school and did everything I was supposed to do. And then I looked around after a while and I said, there's something really missing here. And so I started going back to Mexico, and I said, I can actually breathe over here. It's amazing, but it feels like you're wearing armor in the United States. You get stopped by the police and, just get tachycardic, and you never know what's going to happen. And I just never had that kind of experience in Mexico. So that's where I wound up back there. And then I developed a training center, and I also train people in how to communicate in Spanish. I can provide up to 100 CMEs. And so I've been doing a lot of things.
What's the name of your company?
Well, PaceMD is the company. We're PaceMD, and we are just finally incorporating in the United States. We've been in Mexico for 25 years.
Well, good. Well, I'd like to do one of our Black Health Trust programs from Mexico with you and your program, and get you featured.
We're reaching out to the Afro Mestizo Black communities, trying to figure out how to train them in things like obstetric first responder and just basic first aid and trying to deal, because these are marginalized communities. And you should look that up. Afro-Mexicans, just do a search. I mean, it's kind of mind-blowing, really. But so we have an opportunity to do some of that, and I'm working with the government to some extent. Well, I've worked with them in a lot of different places, but I've asked them to give me the stats that we need for that area so we can figure out if there's things that can be done. And, one of my dreams is to have, US Black doctors come down there, learn Spanish and learn a bit of that culture, because I think that would just open everybody's channels of communication and learning. There's 50 million Spanish speakers in the United States. I mean, this is a really important skill, and it helps us. It helps us as Black people. It helps us as Americans. It helps us all over. It's a win-win thing.
One of our other members, Dr. Helen Davis, who's an ophthalmologist, she was on a fellowship program a month ago in Mexico.
Okay.
She called me up. She was so excited
Yeah.
about the Black Mexican doctors that she met
Yeah.
and everything. So we'll have to do that. I sure thank you for agreeing to give us a few minutes. I'd like you
Sure.
to just hang in here with us
Okay.
before we talk a few things
All right.
about health advocacy. And I promised that we'd open the mic so some of our audience can speak with us and make statements or ask questions. But Dr. Nabor-Stevens, what do you think about talking about some health advocacy things that we talked about?
Well, it is certainly my pleasure to talk about this. I had made the promise at the end of a program a while back, not too long ago, that we would circle back to the whole question of advocacy. And I've been thinking about it ever since. I've been trying to find someone else to do the talking. I have yet to find somebody else to do the talking. So I said, to the extent of my expertise, I would certainly,
Which is considerable.
well, whatever it is, I'm willing to share. But how things have a way of working out and being guided. So just today, I saw this story. The CDC issued a warning on July 27th, 2023, about a new threat, a new problem in this country, which is being, not surprisingly, fueled by, no pun intended, the climate change and the heating up of the United States. And they issued a warning about alpha-gal syndrome. Now, I'm not going to ask anybody, do you know? I will say I had never heard of this. Alpha-gal syndrome is a syndrome where people who get bitten by a specific deer, the Lone Star deer tick, the Lone Star deer tick.
Okay.
If they get bitten by that, they can develop this alpha-gal syndrome. So what is alpha-gal syndrome? Well, alpha-gal is a disaccharide found in most mammals. It can be found in all forms of meat, but not fish, not reptiles, not birds, and not people. When you have this tick bite from a tick that's infected from the Lone Star deer, you get this alpha-gal into your system, and you develop a terrible allergic syndrome, which can run the gamut from rashes, itchy eyes, to full, what we call anaphylaxis, where you have swelling of the tongue and throat and difficulty breathing, and it can be awful. The other thing about it, if you get it, most people tend to not get over it. And so whenever they eat meat, they are at risk of having the symptoms again. It's also because gelatin is made from animals. If you eat Jell-O, or if you take a pill that's in a gelatin capsule, this can trigger the reaction as well. Now, over the last decade, it's been estimated that about 100,000 people have this syndrome, but the CDC thinks it's probably way more than that, like over 450,000. The problem is nobody really knows about it, not doctors and not people. And so it is frequently not diagnosed because nobody knows that it exists. It's a question of you don't know what you don't know. So no one really gets a lot of people probably.
Any markers?
Yes, there is a marker. You can, in fact, the diagnosis, since I wasn't really talking to the physicians, but to make the diagnosis is actually a combination of history, real good detective work, and IgE antibody test.
IgE?
IgE as in egg.
Wow.
Yeah. So now, how did that make me think about advocacy? Well, as I said, you don't know what you don't know. And the key to making this diagnosis is real good history. And so it's a good chance, unless you have a physician that has had the opportunity of seeing this syndrome before, there's a real good chance if you have it that they won't know anything about it and think about it, which leads me to my conversation now about being your advocate, your own personal advocate. So when you think about advocacy, a lot of people get intimidated. Well, people are intimidated anyway. That first of all, you may not even be feeling that well. So you don't really think that you have to be, I don't want to say defensive, on the offense, let's put it that way, on the offense when it comes to your health. But when you're having your encounters and interactions with the healthcare industry, you need to be prepared. And this is such a big topic that I decided today, since we have limited time, I was going to limit this to conversation about interactions with physicians and in the hospital. And I'm going to save talking about navigating the healthcare system for another day. So when you are going to have an interaction with your healthcare professional, there's some pre-work you need to do. And that pre-work will enable you and empower you to be able to have a more fulfilling and rewarding encounter with your professional. Some of the things that you need to do are to, over the course of time, keep notes. When something happens, you may or may not remember it, but keep a notebook of things that happen, and you say to yourself, that's different, or that's not like me, or I'm not feeling this way usually. Write it down so that you can have a history to refer to. And then you want to make sure that you formulate in your mind, what is it that you want to get out of that visit? What are your concerns in the first place for going? And whatever those concerns are, write them down. And whatever questions you have regarding those concerns. When you go in, it is extremely valuable to take somebody in with you as your advocate. Now, if you think you can handle it all on your own, that's fine. I'm not trying to infer that you can't, but most people will find it very beneficial to have another person there listening while you're there talking and interacting with that health professional and taking notes, so that later on, things come up, you all have had a shared experience and you can discuss it. Also, if possible, your person that goes with you hopefully has shared in the homework and has some idea of what needs to be accomplished in that visit. you want to make sure that you ask the questions that you have and you take your notes. And then you want to, at the end, give the healthcare provider feedback on the encounter. We call them encounters.
So I guess it's about to leave. I just want to ask you, you're an emergency room doctor?
Yes,
Have you ever heard of this tick? Is it in Texas or
it's a
Mexico?
Lone Star tick. Yeah, well, so the first thing we always think about these with tick bites is Lyme disease. What I'm seeing about this particular condition, though, is like you said, it's mostly kind of immune mediated. And from an emergency point of view, if somebody's showing up with signs of anaphylaxis, that's the thing that we treat. It's unusual for us in the emergency department to even know necessarily what people are allergic to. I mean, so the allergic response is kind of generic, and if they're allergic to peanuts or eggs or whatever it is, they have the same response. Without skin testing, you don't know. I can see where we would wind up treating this generically and with antihistamines and steroids and possibly epinephrine if needed. And then if they continue to have, they keep breaking out with rashes and stuff, then they might go ahead and get the IgE to figure out if that's there. The question, of course, is, okay, now that you've defined it, how are you going to treat it? I mean, I'm not sure that we're talking about antibiotics or something that's curative there. There are people who have these kind of chronic immunologic conditions, and we don't
You
know
have to not eat red meat.
and we don't know what it is. Yeah.
Yeah.
Well,
The
so
treatment is you don't eat red meat.
but you'd have to find it first.
Right. Once the diagnosis is made, absolutely.
Yeah.
Which again goes back
So-
to the index of suspicion.
But I mean, there's certainly a lot more to it than what I just said. But I can tell you that since it's immune mediated, then we have to treat whatever the immune response is.
And when I have people with allergies, one thing they ask for, if you taking care of any chickens in the Southwest or in Mexico,
Yeah.
and I look for the
ticks.
IgE elevation on a immunoelectric.
I imagine they'll wind up on skin tests kind of panels. At least my experience is, you send somebody for skin testing, half the time they say, we don't know what it is. The skin test didn't help. So it's, from a functional point of view, it's okay, now you have a chronic problem. Maybe you should stop eating something or try, it's kind of generic.
No more steak, Barbara.
I know, but I don't have it yet. So I'm still going to have my steak once a month. Thank you. I meant to say this, though, about the distribution of this disease, because I found this very interesting. If you can imagine a map of the United States and draw a line up through the middle of Texas, going all the way up, and that will catch the eastern corner of Nebraska, and then draw that line east all the way up, all the way to the East Coast and all the way up to New Hampshire, Vermont. That's the distribution of this bad boy. The whole Southeast and a little bit of the Midwest up to the Michigan, Lake Michigan border, and then all the way up the East Coast.
It doesn't help people to call it the Lone Star tick, because that makes everybody think that this is Texas. And this is just it's a tick-borne disease. Like, there are a bunch of rickettsial illnesses and other types of infections. And this is some kind of variant on that. It looks like.
Okay.
Yeah, and
Well,
I'm sure it's not the
States.
last that we're going to see. We're going to continue to see variations on this theme.
Yeah.
It goes on.
All right. Well, it was great talking with you guys. I do have to run.
All right, thank
Okay.
you, man.
So
Okay.
nice meeting you. Thank you.
Sure. Thank you.
All right, so back to the advocacy. You want to let the doctor know that, either you did or you did not meet my needs. And I used to tell my patients, now my patients were children. I used to tell my patients' parents themselves that, don't get up out of that chair unless you understand what it is you need to understand after seeing that doctor. It's crazy to leave not understanding what's going on. If the doctor has said whatever it is they're going to say, and you didn't understand it, and you didn't let them know that you didn't understand it, how are they going to know that you didn't understand it? So, there is some co-responsibility in this whole relationship, whereby you need to give the appropriate feedback and demand that certain things occur. If you have a situation a condition or a problem that you don't feel has been adequately addressed after you've had your exchange and interactions with your provider, don't forget you can get a second opinion. Most insurances cover second opinions. So don't be embarrassed to ask for a second opinion. And you also want to know, if this is the first time you've dealt with this physician, you want to ask them, if I have a problem or an emergency, how do I get in touch with you? And make them say to you what the process is. Don't make any assumptions about that. So these are just some of the things, not everything, but some of the things that I would encourage you to think about in order to get the most that you can out of your relationship with your provider. I wanted to mention, though, that when you're in the hospital, there's some things that you have access to that you may not know. It's not necessarily something that's advertised. If something is going on in the hospital that you don't like, you don't have to lay there and take it. You're not totally at their mercy. Again, hopefully you have your advocate or your proxy involved, but I would remind you or let you know that all hospitals have an office. They may call it different things, but it's basically patient advocacy representatives. So if you have a problem, you ask for the patient advocate to come in. And if that still doesn't get the job done, there's a hospital administrator that you can say, I want to see the administrator, and I want to see the administrator right away. So you're not totally helpless in that hospital situation. We're going to be talking more about signs and some signs that things are not being done for you the way it should be done for you in the hospital in the upcoming weeks. We're in the process of finalizing a speaker who's going to talk about racism in the hospital, which I think is going to be a very interesting talk. We had a couple of questions. Tanya wanted to know, what is the treatment? Well, as Dr. Hall said, it's an allergic reaction. So it's treated like allergic reactions, antihistamines, steroids, some of the other drugs that are used for allergic reactions. But if you actually have developed this syndrome and your signs and symptoms, because it can be a spectrum of severity of symptoms, if you are one of these who has severe symptoms and you keep having flare-ups, the culprit is red meat. And so you will have to eliminate red meat from your diet, as well as making sure that you don't get into anything that has steroid, magnesium stearate, and a few other compounds, because they will trigger this reaction. And Dr. Gibson had his hand up.
Dr. Gibson?
Yes, I it's unfortunate the good doctor left because he mentioned something that is very, very, very important, and that's Black maternal mortality. In this country, we have a mutual opportunity destroyer that is killing Black women left and right at an incredibly high rate, especially when you compare the number of maternal deaths that happen to white women compared to Black women. And this is, when I say equal opportunity destroyer, it does not matter the educational level, the income level. And the problem is primarily a result of the fact that Black patients, Black female patients in particular, do not get the kind of care they need that Dr. Nabert-Stevens is talking about in hospitals, because they complain, and their complaints go unheeded. So the advocacy perspective and doing something about it and getting those folks that have as their primary responsibility in hospitals to respond and early on, especially in maternal situations. Here's the reason why. A simple headache. Well, it's not so simple if the patient is pregnant. A Black mother who has a headache, that may be an indication of possible preeclampsia. Well, what is that? That's hypertension on a crisis level. And that's something that, along with other problems like, for instance, pulmonary embolisms and the rest, are killing Black women at a really astounding level. So I had to just, ring the bell on that one, and what the good doctor is doing in Mexico. I think we could stand to put a lot of that to work right here in urban America. Thank you,
Very
sir.
good. Thank you so much, Dr. Gibson.
I just want to tag on to what Dr. Gibson was addressing from the maternal health. The majority of the problem is not immediate. Although there are, let me not mitigate this. There are definitely pre-discharge maternal deaths, but the majority and the real concern is related to the maternal deaths that are occurring post-discharge, all the way out, even to 12 months out. And again, what Dr. Gibson is alluding to, this is where we have to really advocate for ourselves. If we find ourselves in a situation where our signs, symptoms, and concerns are not being adequately received. I don't see any other questions in the chat.
So Dr. Sander, you're an ER doctor. Do you have any comments on what the gentleman had to say?
And then we have a hand up.
Yeah. Okay. Thank you, Dr. Maxey. Yeah, no, he was terrific. It makes me wonder why we don't have those programs here in America that he's doing in Mexico, in that there are plenty of communities that don't know which way to turn and have no protocols and no training as to common emergencies, especially for pediatrics and for gynecological type obstetrics and gynecological. So I think what Dr. Hall's doing in Mexico and all is going to flourish very well here in the United States and elsewhere, especially in rural communities and places like that. There's very little outreach. I can tell you up here, there's essentially no outreach at all into the rural communities for this sort of thing. And I think it'd be really welcomed all around the country. So for me, being an emergency physician, that was exciting to hear that someone is blazing that path. And I think he'll find a welcome wagon at every corner here in the United States.
Does anybody actually get sick in New Hampshire?
Excuse me?
Does anybody get ill in New Hampshire?
Oh, yeah, sure. And we have
Other than falling off a bicycle?
Yeah, that's right. That's right. Well, what we have here, when I fell off my bicycle and actually had a fracture of C5, I just looked at it on the transverse process, and I had to have an emergency decompression surgery. I wasn't taken by helicopter, but most people are. I'm not sure why they didn't take me, but I was on what would be considered a rural road, in that I waited almost an hour for a car to pass by and see me laying there completely paralyzed in the middle of the road. So, I was very fortunate with the outcome. But I think that if we had more of an outreach, like Dr. Hall is doing, I think that'd be helpful. Whoops, there go the drugs.
Great.
Did
Any
you
other questions in the chat?
Miss Vanilla?
Good afternoon. Good afternoon, everybody. I'm not, and I apologize for missing the first part of the program. I totally forgot. But I'm curious to see whether anyone have any statistics as to the gestational age that most Black women enter prenatal.
I'm sorry, could you
Can you
repeat
repeat
what the
that?
question was?
Yes. Do you have the statistics as far as which gestational age that most Black women enter prenatal care? Is it first trimester, second trimester? Does anyone have that information?
I don't have it at my fingertips. Certainly that information is available. It is skewed, shall we say, by economic situation. In the Medicaid population, there's a high percentage of late entry, but it's not necessarily why you might think. It's not because they don't want to access the care early on, but they weren't on Medicaid, and it takes a minute to get on Medicaid and then be able to access the care. In commercial populations, it's not that there's a late entry, but I tell you what there is a huge issue with, and that is the pre-pregnancy comorbid conditions have a huge impact on maternal outcomes. So if you have a woman pre-pregnancy who is dealing with obesity, dealing with high blood pressure, dealing with diabetes, it puts her in a much higher risk category for complications during the pregnancy. But then we have perfectly healthy young women who are running into problems, and we're still trying to unravel it. I did just read 2 weeks ago, and I'm not an OB, but I find this very interesting. There are some new protein markers that have been tied to the high degree of predictability of future development of eclampsia. This is game changing, because now all pregnant women at the beginning of the pregnancy can be screened and then monitored appropriately down the road for the development of preeclampsia. So, it's a bad situation that we're in. And just because we have these tools, if you don't have access, it's not going to help. But we are making some progress. And I was really encouraged by that news.
Mm-hmm.
Thank
And I
you.
think on the other hand, I think we have to, unfortunately, the African American women, we have to reach out to them more than the other women. I don't know why. I do OBGYN. I'm a nurse practitioner, actually. And my African American patients tend to miss more appointments than the other patients. And it's not that they don't have access to the clinic where I am at. I have, for instance, there was a young lady that I provided care for her previous pregnancy. So she knew, the importance of early prenatal care, because we teach that, because we see poor women. That's who we serve, is poor patients. So, but the next pregnancy, she came in at 24 weeks. And another patient, we would call and, encourage her to come to her appointments. I personally called her to let her know she missed her appointments. And basically, she really was not happy that I called her. So I think there's a lot of other things that are also in play with our community. And I missed the presentation of, I guess there's a certain type of protocols that they're doing in Mexico to address these issues. So that would be something that I would be interested in learning.
Where are you located, doctor? Where are you located?
I was trying to mute myself.
Yeah, where are
Yeah,
you located?
in Wilmington, California. The practice
Where is
is FQHC, California.
Where's Wilmington, California?
It's between it's Los Angeles Harbor.
Okay. Down by Martin Luther King, Charles Drew?
We do serve patients from that area, although we're not located in that area. Actually, I know Dr. Bean. I think we had Dr. Bean as a speaker before. Dr. Exelana Bean.
Yes.
Mhm.
Yes, she is our executive medical director.
Okay, we'll have to make your acquaintance sometime. Speaking of which, Dr. Wilbur Jordan received a lot of honors this week. He received, I think, the Meritorious Award for Service. He's one of our charter members of our advisory board. We unfortunately lost him a few months ago, but he's somebody we've known for forever, and they really gave him a lot of honors here. So we're getting close to the top of the hour. Anybody else have any questions? We're gonna open the mic and give you a chance to talk, to ask questions or make a statement.
May I?
Go ahead.
Actually, one of the points that the good doctor made at the onset that I think is pretty useful for us to consider, in addition to paying closer attention to this Black maternity crisis, it would not be a bad idea for for us to encourage our students early on in even as early as primary on up through secondary education to perhaps take some Spanish courses, because it's actually the number 2 language in the United States of America. So I think that it could be advantageous in terms of not only being able to communicate with Spanish speakers that are from other parts of the world, but they're actually, as we learned today, I learned anyway, that we have some Black Spanish speakers, and actually I knew that already because of Boricuas and Cubanos, people from the Caribbean areas, but I really had no idea that there's such a rich cultural connection
Dr.
in
Gibson,
Mexico.
I read something a few years ago that says 70% of the people that we call Latinos are Black.
No me digas.
Huh? I don't know if that's true, but especially those from Panama and Brazil.
Sí, claro. Hay mucha gente por todos los Estados Unidos y también en el Caribe, allí en Latinoamérica y España, por todo el mundo. We are everywhere, brother.
Well, it's also a business imperative going forward. Many job opportunities are beginning to require the ability to be bilingual. And I'm a member of a women's physicians group, chat group, and most of the members are actually down in South Florida. And they have been discussing lately how they're facing job discrimination in the South Florida area if they are not able to speak Spanish. But, all of these are things that are adding up to the end situation of lack of access to providers. And I don't want people, I keep bringing it up, but I don't want people to let it out of their sight. All of the court decisions and all, and affirmative action or not, all of those are barriers. But the fundamental barrier that we have is, for example, 9% of all Black high school graduates have access to calculus or any other higher forms of math. We won't be doctors if we don't start at kindergarten and bringing these kids forward so that they can attend the schools that they need to attend in order to become our health professionals. We have a crisis in our pipeline. And this is something that we can do something about, because we all live in communities that have schools, and we can all become more active in what's going on in our public schools, as well as supporting out-of-school programs that are giving the kids additional training so that they'll be competitive as students. All right, I'm off my soapbox, but.
I must say to the good doctor's point, repetition for the sake of emphasis definitely has its merits. So I must say amen, amen, and a very good Sunday, amen.
Great.
Dr. Maxey, I want to close us out with some thoughts. I'm sorry that Dr. Dawes isn't on. I have been hearing with concern about what's going on in Haiti, although not that much information is being shared on the national news. I know that Haiti has had trouble for a long time. I know that there is culpability of the US in some of that trouble that they got, but it seems like it's boiling up into another crisis. And I just want to raise our brothers and sisters in Haiti on the program today to our attention and extend to them my prayers and hope
What
that
is the crisis going on in Haiti?
they fear that they're getting, the rioting is going on, the gangs have taken over, things are just totally out of control now.
It's Willie Lynch.
You said Willie Lynch?
Yes, sir.
Okay. And now also something else that was on the news is the unrest in Niger, if I
Yes.
said it right. And
More Willie Lynch.
yeah. And we know that not only is China and Russia raping the continent, but so is the United States. And we have a huge military command, I understand, on the African continent. And so maybe we'll bring some of that to the table. But I thank everybody for their being with us today. And I know we have a big convention and hope to come out of here with a lot of knowledge to bring back. Are there any final questions and things that we need to address, Dr. Neighbor?
No other questions.
If I might, in closing, I would encourage everyone to really listen to what Dr. Neighbor Stevens is saying today, because she's dropping serious knowledge. Also, the good doctor at the onset, Dr. Hall, I believe it is, the same is true, because what he's trying to do in Mexico, we need to do that here. We have a very, very serious problem with Black women dying, and we have to do something about that. So we don't have to wait on that one. We must get busy early and often with the babies, primary school students, work with them, encourage them, and to teach them, don't be afraid of mathematics. It's something that you don't be afraid of the STEM. That's the key. I believe the children are our future. So we have to do what we must do as adults for them, because they don't know what they don't know. A lot of us still don't know what we don't know, but I'm just saying the babies need our help. Thank you.
Well, thank you. And thank everybody for their attention to us today. Any final words, Dr. Stevens?
No, I want to thank everyone for coming on and to thank you for your continued support. We are having some technical issues with communications. We're working hard on trying to solve them. I just beg you to please hang in with us. Let me just say, though, also that I'm going to be gone for the next 3 Sundays, but I should be back with you the last Sunday in August.
Well, thank you. Everybody's going on vacation except me. Thank you. Thank you, Simon, very much. Thank you, Dr. Gibson, and everybody for being with us. Have a great, great Sunday.
Bye.